Okay, I think we will start. Good evening, everyone. Respected Dr. Surya sir, members of Safe Dental Updates, and dear doctors. Welcome back to our 31st Learn from Our Master series organized by Safe Dental Updates. And it's always an honor to be here. So we'd like to do a little bit of an introduction about ourselves. So we are Safe Dental Updates, a dental platform in which we believe quality education always ensures predictable outcomes for dentists of all disciplines and abilities. Our organization is based on the fact that the dentistry is complex and requires ongoing learning experience. We conduct various workshops and webinars to enhance the skills of dental professionals and guide your dental journey. So without further ado, let us start our series in which our topic of discussion is aesthetic composite restorations with new spectra, given by Dr. Surya sir. To speak a few words about him, Dr. Surya Bharath completed his BDS from Vishnu Dental College and MDS in Conservative Dentistry and Endodontics from PMNM Dental College. He has published various articles and is a product analyst of 910 Dental Company and Safe Endo Company. He's a course mentor for basic and advanced rotary endodontics from Roots to Crown Academy and also for micro and macro dental photography. His clinical practice is focused more towards biomimetic dentistry and microendodontics. So without wasting more time, I would like to invite Dr. Surya sir for today's discussion. Sir, please.
So, good evening, everyone. First of all, I would like to tell happy Dentist Day for all of us. So, dentist is a combination of art, engineer, and the doctor. So, I would like to thank Dr. Shanu for the beautiful introduction and for creating this absolute platform for sharing the knowledge among us all over India and abroad also. So today the topic I have given a topic about aesthetic composite restorations with Neo Spectra ST from the Dents Plus Sirona company with this composite belongs to. So this entire 45 minutes to 50 minutes will be on discussion about composites and its clinical applications. I'm not going to talk about the literature aspect and all. So we are all aware about all these literature aspects and all. So I would like to tell how to handle a composite case whenever the patient has visited to our dental clinic or a dental practice in order to get the aesthetic appearance. So before going to the topic, I would like to share my screen. So good evening, everyone. So as I discussed, the topic is about aesthetic composite restoration with Neo Spectra ST. First of all, before going to this about in detail of Neo Spectra ST, what the composite materials are available in our day-to-day markets are some 3M company and tetric and serum and beautiful from the Shoko company and GC Solaris Sculpt from the GC company and all. So whether all these composite materials are giving aesthetic appearance or not, whenever we want to handle any aesthetic case or especially the smile designing case, we need a dentine shade, enamel shade, incisal shades and all. And apart from all these things, we need to buy so many amount of the kit and composite materials. So in order to get the aesthetic appearance and the adjacent tooth color and all. So this Neo Spectra ST is a universal composite bulk fill nano hybrid material. So this is this era is completely about nano hybrids only. Previously we used to have traditional composites and micro hybrid, smaller hybrid and all. So now it's a nano hybrid era. So this entire Neo Spectra ST is a combination of nano hybrid. So whenever we need a proper shade, suppose with a shade of C2, so which are available in our market, and after you get wasted because of the respective of the shade. So with this composite material, whatever the shade will be belongs to only on 5 shades only. That is from A2 to A4. So whether the shade belongs to B1 or B2 or C2 or D3 or B3, this entire will be available on the beta shade. So we'll take the beta shade guide and we'll place it on the adjacent tooth. We'll select the shade color, and followed by we'll just match with the composite material, universal composite material of this Neo Spectra. Okay, whether the shade is resembling to the composite material available or not. So luckily all the shades will mimic either of this entire 5 shades only. So whatever the shade you will get, the in that 5 shades only we'll able to get this proper shade. So this is a basic introduction about this Neo Spectra ST. So second thing, how the composite material is available in the market. So whether it's a capsule form or whether it is in a syringe form. So coming to the capsules aspect. So here I see the capsules are like this will be available. These are being used in order to prevent the cross contamination. Whenever we use the capsule during a time of restoration,
Hello, sir. Hello, sir.
it prevents the cross contamination.
Hello. Hello, sir. Sorry to interrupt.
And there will be less material wastage. Hello.
Hello, sir. Sorry to interrupt, sir. I think the network from your side is like, I think
Hello.
yes, sir. I think there's a slight issue with your connection, sir. Network connection, sir. There's a few interruptions
Hello.
in between.
Yeah, yeah. Yeah. Hello.
Yes, sir. I think it's fine, sir. Please
It's
proceed.
fine. Okay. So in this composite material, this basically is available in syringe aspects and the capsules aspect. So these capsules will be mainly useful in order to prevent the cross contamination. Whenever we are using from one patient to other patient, this is the only limited amount of material we usage, and followed by there is won't be any cross contamination from one person to other person. That is the basic advantage of this capsule. When come to the syringe aspect, whenever need higher quantities, this syringe availability will be little bit more. And also, whenever we take one small increment from the syringe, the material won't get rapidly because of the chair light or because of our clinic light. So the adequate working time and the setting time will be adequate for this composite material when compared with other materials which are available in the market. So this is about the NeoSpectra ST. So we are all aware about small things which we are using in our day-to-day practice on while handling the composite case. Okay, so whenever we are using a composite restoration, we need to keep it in our mind that what is the amount of adequate curing time, and whether the shade of the resin is properly gets matched, or whenever we are using little bit darker shades, as in the beta shade, A1 is a A1 or B1, the lower value will stands for the lighter shade, and the greater value will stand for the darker shade. So whenever we are using the darker shades and all, we need to cure little bit more amount of time than curing lighter shades. And coming to the temperature aspect, whether how many of us are properly storing the composite materials. Either there some people will be store in the refrigerators, or some people will be leave it on the chair sides only, or some people will leave it on the trolleys aspects and all, or some people even uncap this uncap the entire syringe material also. So this will causes the lifespan and also the efficiency of the composite will be decreased. So what is the adequate thickness? Some people take one entire scoop of the composite material and will place it and place it inside the cavity, and then they will start doing all the condensation process, and then they am I audible now?
Yes, sir. Please proceed.
So when comes to this light source quality, Hello. Hello. Hello.
Yes, sir. I think the connection from your side. Okay, now.
Yes. Can I continue?
Sir, I think your voice is breaking up a bit.
Okay.
Okay, please proceed, sir. If anything is there, so I'll try to interfere.
Okay. Hello. Is it okay?
Yes, sir. I think it's fine now.
Okay.
But if anything is there, I'll try to interfere.
So this entire SDR capsules will be in this package form. So with the help of this dispensing gun, and these capsules will be loaded into this dispensing gun. So previously in the older techniques, there used to be like when we have to place a small amount of liner and followed by incremental buildup of the composite material. So with this SDR capsule, instead of placing a liner, we can directly will place this SDR flowable bulk fill composite material. So till 3 to 4 millimeters of increment, then followed by the last increment will be universal capping of this any composite restorative material with respect to of the shade will be placed in order to prevent the adjacent tooth wearing from the composite restoration. So this is the basic difference between this SDR capsule and other materials which are available in the market. So you can look it in this picture. This entire SDR material will be good colored mimic material. So there won't be any other tints and other will be easily visible and all. So when coming to the this Tetric available, this company called Tetric EvoFlow, this is also a capsule based. So it is available in this yellowish tint color. So whenever we are doing the smile designing cases or aesthetic prone regions, so this type of materials should be avoided in order to prevent this biomimetic restorations and in order to prevent the staining of other tooth materials. So this is a small comparison chart, which is the materials which are available in our day-to-day practices. So the first one will be, which I discussed previously, is the material. This material will be the nano-hybrid material, which is available in the syringe and as well as the capsule form. And the second thing will be a display company. This is Spectra. This is available in capsules and the syringe aspect. And the third one will be from the 3M company, that is 3M ESPZ Filtech 350 XT. And the fourth one will be the Beautiful. This Beautiful is from the Shofu company. This is basically a pre-reactive surface glass enema treated particles along with the composite. So this is we can call it as a compomates and all. So coming to the last aspect, this is so why I place this chart, because we are all using all type of materials which are available in the market. So whenever these kinds of materials, when we are using in your aesthetic regions, we need other two materials, that is dentin shade and as well as the translucency shade. So again, we need to buy some dentin shades and the enamel shades and all. Apart from this, buying this entire material. So with this Neospectra ST, basically this entire material will give the entire tooth colored restoration only without buying other dentin shades or the translucency shades. So apart from compared with the other companies which are available in the market. So we select this entire materials, and then how to place. So when comes to the, we prepared one small beautiful cavity preparation, and when comes to the restoration part, we'll be little bit hurry in such a way that we'll finish it off within 5 to 10 minutes only. Our composite restorations or what are the restorations we are going to do. So whenever we are placing these composite materials, we need to have an ample amount of time in order to get the proper seal, and in order to prevent the cross contamination, and also in order to prevent this micro leakage. So whenever we place a small amount of composite material, so most of the patients will feel, doctor, I'm getting a little bit sensitivity aspect after doing a composite restoration. No, we have done beautiful composite restoration. We can show this radiographs and all. So, but there is a concept called as a micro leakage. So even though how beautiful you have done the composite restoration, without following proper protocols, the composite restoration will ended up with the micro leakage process only. So we prepared a beautiful cavity. So with this help of these wedge guards, which are available from the company called Dentsply Sirona company. So these wedge guards will prevent the another tooth from nicking aspects while doing any micromotor application or the aerotor application. This is how we have to place the wedge guards. After that, after preparation the cavity, these wedge guards will be removed and the wedge will be selected. Whatever the type of wedge will be selected according to the contact and the embrasure level. Then we need to select the sectional matrices. So why we have to use sectional matrix? Because whenever we are using patients, especially in the posterior regions and all, these sectional matrix will prevent the entire 360 degrees. So after selection of the matrix, we need to place the matrix, and we need preparation of the cavity and all. Just with the help of this dispensing gun and the selected composite material, we need to prepare the entire composite leveling from the periphery to the center. So most of us do from the time will be wastage of more amount of material. So in order to prevent the material wastage and all, we need to done the composite. We need to do the composite restoration from the periphery to the center. So this is one classic case which is done in my clinic. So the patient came with the temporary restoration. Here the tooth respective tooth number is from 25, and the adjacent tooth is also undergoing a small amount of caries aspect. We had selected the entire, we isolated the entire tooth. We had done the quadrant isolation, and we had removed the entire temporary restoration, and we prepared a proper cavity, and then we restored with this composite material. This is how we need to do. So after selection of the, after removal of the entire temporary restoration, we placed the entire sectional matrix band, and so I prepared the entire proximal area first. Then I came to the occlusal aspect in the small incremental levels only. Then we have done the finishing and the polishing. And this is the post-operative image. This is one more case. The patient came with a dislodged restoration, and we examined the severe pain, and the perforation was the tendon perforation was positive. So what we had done, we isolated the tooth and we started removing the entire the caries progression. So in the step one, the caries is right from the occlusal aspect. When we started removing the entire caries, the culprit is from the below the restoration, previous restoration which is done by the previous dentist. So we removed the entire restoration, we removed the entire caries. So, and there are periapical changes. So we have done the root canal process and we etched the tooth. We placed the entire smart dentin replacement material, that is the SDR material. And then we are according to the tooth shade, we place the restorative material of the and we cured. That is what the posterior. When comes to the anterior, so most of us all are little bit worried about the anterior aspect, that is especially in the aesthetic zone. How to do a proper shade selection and how to get the proper restoration intact and the adjacent tooth and all. So this is one small trick I'm going to share, which I learned from my mentor. Whatever the shade you want to use it for your cavity preparation, take one small increment of that and place it on the tooth and cure it. And we are all having smart mobiles, right? So with the help of the smart mobiles, we'll take a picture and add black and white filter to it. You can easily appreciate whether the selected shade material is perfectly matching the tooth or not. Okay. So here I selected two types of shades, that is from the A2 and the A3 aspect. So I place it on the respected tooth. Here the darker shade is a little bit showing more amount of whiteness on the black and white filter. So this shade is not going to match to the tooth structure. So the A2 shade is properly matching to the tooth structure. We had process, and with the help of our mylar strips or with the help of the BioClear matrices system, we have done beautiful composite restoration with the intact and as well as the perfect shade to the patient, and the patient was happy. There is no micro leakage, there is no shade mismatching and all. This is the immediate post-operative picture which we have taken. So how to do an anterior composite restoration? So suppose this patient came with this fractured tooth. So there is we have confirmed all the radiographic changes which are available. So when the radiographic changes are normal, so we isolated the entire tooth. Before isolating, we need to take the putty index. So with the help of putty index, we need to create a palatal shell. So after creating the palatal shell, isolate the tooth with the help of a mylar strip, and then incremental layer we going to build up. And this is how the immediate post-operative picture looks like. I didn't use any other dentin shade or the enamel shade or the translucent shade, only universal shade I used. So this is how the entire shade which I used is properly mimicking the adjacent tooth color. So here this 17 years old guy came with the help of dislodged restorations and small fluorosis staining of his tooth. So before going to the composite restoration, this is called a button technique. We placed whatever the proper shade we are going to select. Just we take one small scoop of the composite material, place it on the respected tooth, cure it, then take a picture and black and white filter whether the tooth is the composite increment of the tooth is properly mimicking to the adjacent tooth color or not. Once it got finalized, then etch the tooth. The etching processes will be all two types. We are all use 37% orthophosphoric acid. This 37% orthophosphoric acid when we are using, it should be properly a selective use, not using entire, not putting the entire tooth structure and without isolating the other tooth from with the help of Teflons or other matrix system. The other tooth also will get etched. So in order to prevent this type of etching, we are using single bond etching and priming bonding will be single bonded only. With the help of that, we use this selective etch technique and etch the tooth and cure it, then place the entire restorative material, whether this is properly mimicking or not, finalize it. So then we'll place this entire composite restoration with the help of nice increment layers and all. This is how the entire composite restoration looks like. After then, we will use the finishing and polishing process. So sometimes there is no need to use as of aeroter and burrs and all. So how to get this etching aspect and all? With this help of this beautiful machine called as aquacare, this is a air abrasion unit. With this help of this air abrasion unit, the powder from dioxide and aluminum trioxide. So this is how the patient came with this. So there is no need to remove more amount of tube structure. Just will give small amount of bevel and isolate the tube with the help of rubber dam. Then with the help of this aquacare, apply this air abrasion on the selected tube with the help of this aluminum dioxide particles. So after abrading, then place the bonding agent, cure it, and then place the composite restoration material. We'll get the proper shade of this composite restoration materials. And second, this is one more classic case. So this patient underwent trauma. So couple of days back, and he had slight sensitivity and all. So the patient visited my clinic in order to get his tooth repaired. So we had taken the immediate preoperative image, and the patient is also worried because his marriage is coming near. So in order to get the perfect match of this tooth with the adjacent tooth, so what we had done is we had selected this entire tooth with the help of digital software for the smile designing process. We have taken small inputs from the patient also, how the tooth should be look like and what should be the curves and what should be the sound all. We have taken all the patient perspective and saved this entire image under STL format so that it will be easy for the lab people to communicate with the lab people and us. After doing this, we had done this entire crown preparation, and with the help of retraction cord, we place this retraction cord. We have taken the putty index, and then with the help of a self-adhesive resin cement, the entire crown is will be placed and cemented. This is how the post-operative image looks like. It is perfectly matched with the adjacent tooth, and the patient was also happy. So how to remove sometimes there is only removal of only previous restorations and all. So in order to remove with the help of aeroter, there will be more amount of tooth structure. So in order to prevent that, this air abrasion unit will remove only adequate amount of tooth structure and more amount of the previous restorations materials only. This is the video which shows how this entire composite previous restoration composite restoration is easily removed, and the entire tooth is doing the abrasion process. After this, we can directly use the etching and we can directly go for the bonding and the composite restoration. This is how after application of aquacare air abrasion unit. This is the pre-operative image. The patient came with the severe sensitivity process, and when we have taken the history, the patient underwent glass enamel cement, and this is how the glass enamel cement looks like. It's proper. There is leakage and all. That is the reason the patient is having more amount of sensitivity process. So we had removed this entire glass enamel cement, and this is the image. With the help of aquacare, we had removed whatever the composite remnants are present on the tooth have been removed. So here there is small amount of decay had been seen. When we are going to remove, the patient is feeling slight amount of pain, and also it is near to the mesial pulpal horn. So in order to prevent the pulpal exposure, we had placed the putty material of our MTA, and we had placed on the respected area, and we had, with the help of interim restorative material, we had sealed the entire tooth, and the patient is recalled for the next day. We removed the entire putty. We had removed the entire interim restoration, and the entire putty index was set, and we had etched the entire tooth. We placed the SDR material, and we had used this universal composite shade of the respective shade, and we had done this entire. This is how this image looks like. This is the BioStretch putty, MTA putty, which is available in the market. So here, this is one more anterior aesthetic case. Here, the patient came with the dislodged composite restoration, which is done by the previous dentist, and the patient is also underwent the root canal process. So, as the root canal procedure was intact, there is no changes, and these periapical changes are seen. So, we discussed with the patient. There is no need to placement of the post and all. So we can directly restore with this Neospectra ST composite material. We isolated the tooth. We had selected the proper shade with the help of the button technique, which I discussed earlier. And with the help of rubber dam isolation, we have done the entire quadrant isolation from canine to canine. And with the help of the minor strips, we had placed the entire matrix system, and incremental, slow incremental steps. We had placed the entire composite restoration material. We had done the finishing and the polishing process, and this is the final post-operative image looks like. See, it is entirely mimicking with the adjacent tooth. Okay, so we are all have a small doubt that how to handle a composite restoration material. Whenever we are doing small amount of composite material, we should not touch with the other hand. So with the help of this composite Teflon coated instruments, whether it is a blue color Teflon coated instrument, whether it is a gold color, whether it is a black color, it's whatever the color coded and all, prefer to use the blue color and the black color ones only. So with the help of the Teflon coated instruments only, we need to remove the entire small amount of the increments of the composite material. The composite material should not stick to the Teflon material, and as well as it should not be easily free fall from the composite Teflon coated materials into the patient's oral cavity. It should have proper adequate stickiness nature. Whenever it's taken from a small increment, we place it on the adjacent tooth or the adjacent tooth in order to get the proper shade on. Once the shade got finalized, then we need to go for the isolation process. Without rubber dam isolation, whatever the composite restoration which we are going to do, this will be goes for the micro leakage process. So the rubber dam isolation should be mandatory. Then proper shade selection. Then usage of this either composite materials which are available in the market in incremental layer. The minimum adequate thickness for the composite material should be placed on the tooth, respective tooth. It should be 1 millimeter to 2 millimeters. Less than the 2 millimeters, whatever the smaller increments which are placing on the tooth structure will go to failure. Okay. Then followed by placement of matrix system, whether it is a sectional matrix system, whether it is an anterior, especially bioclear matrix system or minor strips and all. It's up to your clinical practice and all. When it comes to the posterior, the sectional matrix will be given proper contour and also as well as the adequate seal to the adequate seal to the tooth structure. So when it comes to the anterior aspect, whenever we are doing the anterior composite restoration, the matrix system should be either bioclear matrix system or the minor strip. Whenever we are using minor strip, take the adequate minor strip only, not the full length. How much amount of length should be easily placed on the tooth structure without interference with the hand movements and also with the patient oral cavity. Okay. Then slow incremental process. When we are doing anterior, we need to prepare a palatal shell. Then from the palatal shell, then we have come from the label aspect. Okay. Without creating palatal shell and all, whatever the composite material you are placing on the tooth will be more amount of wastage. So then after that we need to remove the help of a crown preparation burrs and all. So in order to prevent that, we need to take a putty index, prepare a palatal shell, place the palatal shell according to the palatal shell. Then we need to prepare the entire composite restoration. Okay. When comes to the anterior, when comes to the posterior, we need to do the sectional matrix isolation. First, initially the tooth should be isolated with the help of rubber dam. Then, with the help of wedge guards, prepare the entire cavity with the help of the wedge guard. Remove the stainless steel guard and select the proper wedge. Then select the matrix, place the wedge. Then night ring should be placed. Then check whether the night ring is stable or not. Then you go for the composite restoration. And composite restoration should be periphery to the center, not from the center to the periphery. Okay. So suppose especially in the 7th and 8th regions, we need to do a composite restoration. These SDR material is useful in order to get the increments layer. So with the help of this SDR material, we can directly use it with until 4 millimeters of the increment. Then the top layer should be composite material in order to prevent the wearing of the adjacent tooth structure or the neighboring tooth structure. Okay, this is how the composite restoration should be done with this help of this NeoSpectra SD. So this is a brief webinar which I had done by showcasing only the cases only apart from the literature aspects and all. As the literature aspects, we are not aware. We are not aware about all these things. So I discussed the most amount of the clinical cases and the clinical contributions which we should do when we are using the composite restorations. So I would like to thank Dr. Shanu for his uh, for creating this beautiful platform to share the knowledge and all. And I would like to thank all my mentors for guiding all these things to share this knowledge among you. Thank you.
Thank you so much, sir. So if anybody has any queries or any questions regarding about the topic, please post it in the comment section.
So this is how I want to discuss a little bit. So this is how like we have to do a proper class to cavity. We need to select a wedge, then we need to select the matrix. Then after selection of all these things, place the matrix, place the wedge, then place the niter ring. So whenever we use little bit higher amount of condensing forces, also this niter ring will be able to take on the condensation forces, and it won't be any other forces which will be applicable on the structure. And this is what I discussed. This is from the periphery to the center. Then only we will get the adequate amount of tooth structure and all, and you will get the proper result.
Okay, sir. I think we'll try to answer the questions regarding about the topic in any social media platform, sir. So I think
Okay.
we'll end this discussion. So
Okay.
thank you so much, sir, for sharing your knowledge and expertise when it comes towards aesthetic restoration with Neospectra composites. So definitely, many of us would leave this discussion with amazing takeaway points and implement techniques as per discussed. So thanks to all
Thank you
doctors
so
who
much,
have
sir.
participated for this webinar, and I hope all of you will depart this session with positive, confident manner. So thank you so much, sir. It was actually very informative, and
Thank you, Dr.
appreciate
Shiva,
your
for
valuable
giving
time
this
towards this
opportunity.
participation as well, sir.
Thank you. So, thank you, participants, for spending your valuable time and all. So, whatever the queries you want to answer me, I will answer on the platform, LEN platform. So, thank you, and once again, happy Dentist Day to all of us.
Thank you so much, sir.